So for a new patient who has just received a diagnosis of lymphoma, I think it's critically important to understand and to press your physician to better define exactly what type of lymphoma they think that you might have. And that's because while therapy for lymphomas has historically been really quite successful, we're learning how to better treat lymphomas by defining groups of lymphomas that are treated in distinct ways with different combinations of drugs or different drugs, and usually with a goal in mind of curing patients. And it's one of the important things to keep in mind for a new patient with lymphoma. The sorts of staging or defining how much disease somebody has is usually defined in a series of tests that are likely to include CT scans or CAT scans, PET scanning, which is a way of looking metabolically at the tumor to see where it might be, and it's a pretty sensitive way of distinguishing whether a lymph node is likely to be involved with the tumor or not. And oftentimes a bone marrow biopsy to define whether in fact there's involvement in the bone marrow. And this type of staging helps your doctor decide whether in fact you need systemic chemotherapy, might be cured with just radiation therapy, or might in fact benefit from a combination of chemotherapy and radiation therapy.